Thank you. Thank you very much. No, please be seated. Thank you. Good morning, everybody. It's with great pleasure that I come here to join you in the opening ceremony of the 5th International Global Network of Public Health Nursing Conference. I warmly welcome all our visitors to Kenya and wish you an enjoyable stay in our country. I congratulate the hosts, the School of Nursing Sciences, University of Nairobi, and the Ministry of Health for this conference, hosted in Africa for the first time. It's indeed an honor for Kenya to be selected, and I thank the organizers for successfully bringing together this diverse network of medical professionals and health partners. This conference is timely because it coincides with the International Nurses Day, which was on the 12th of May, and the National Nurses Week celebrations, where nurses world over are recognized for who they are, the heart of the health workforce, for the sacrifices they make, for the care they give. The theme of this conference, Public Health Nurses Achieving Sustainable Development Goals SDG 3, Good Health and Well-Being, is important to our country, Kenya, to the African continent, and to the world, as we continue to grapple with challenges of providing quality health care in a dynamic global health system. This theme resonates with my own efforts through my Beyond Zero initiative that seeks to ensure optimal health and well-being for mothers and children. Today's health landscape pivots non-communicable diseases as the leading cause for mortality in the world, with heart, cardiovascular, and diabetes contributing to 80% of these deaths. This has contributed to the double burden of disease that many African countries struggle with, leading to major challenges to the already fragile capacity of our national health systems. Sadly, this is worst for vulnerable groups, including the elderly, the poor, the less educated, people living with disabilities, and marginalized communities. Improving our health outcomes requires multiple actions at different levels, and this conference recognizes public health nursing as a core component to quality care. Healthcare facilities for a long time have been organized around treatment and emergency interventions, which either lead to recovery or death in the short term. Research recommends sustainable solutions with long-term interventions that extend beyond the care for the sick to encompass advocacy, education, and community health. This is the domain of public health nursing. Ladies and gentlemen, the evolving role of public health nursing will be a conversation that you will be considering over the next 3 days, because we have to avert preventable diseases, provide better care, and improve the quality of life of our people by focusing on community health promotion and prevention. A strong health system requires a competent and caring workforce. Globally, nurses provide over 80% of healthcare services. In my work and visits to health centers across Kenya, I have witnessed the role of nurses and community health workers as key influencers in the health and well-being of patients, communities, and the populations they serve. I have seen your hard work, your combined talents and dedication. You are the first point of contact with the community, sometimes braving very challenging conditions. Public health nursing goes beyond just being a job in a health facility, and this human resource must be recognized for their indispensable role. More resources and training programs for public health workers must be allocated by governments to ensure high quality standards are maintained by this cohort of health professionals. There is need to consider improving our healthcare systems by promoting a patient-centered model that focuses on the needs of the individual in the continuum of specialist care. It will certainly benefit all our healthcare systems if we invest in building a strong cadre of public health nurses through rigorous training, specialization, and practice to enhance their skills. Nursing clinics can play a pivotal role in revitalizing healthcare systems, as well as charting out improvements of our healthcare delivery systems through evidence-based interventions. I'm pleased to learn that we have started to embrace the idea of public health nursing, demonstrated through the progress public health workers are making in contributing to the achievement of SDG 3. I encourage you to continue to strive for professional excellence and high-quality disease prevention interventions. I have no doubt that you'll be able to come up with innovative models of healthcare systems that will better respond to the evolving health needs of our time. I urge governments and health partners to work together to take forward the resolutions and recommendations made at the end of this conference, as we also renew our collective commitment for the overall health and wellness of our people. I wish you an inspiring and fruitful conference and now declare it officially open. Thank you.
Excellency is now performing the official opening as she unveils a round of applause for Excellency International Public Health Nursing Conference here in Kenya. Now, Excellency, the First Lady is going to stick Kenya at the position where it's supposed to be, Your Excellency. Excellency is now sticking Kenya. It has come in the Kenya is there, representing and joining other countries. Continue saying, I'm gonna let it shine. The nurses are saying, this is the little light we are carrying, they let it shine and shine out there.